स्टूडेंट्स को कैसे देख सकते हैं? हाँ, आप लाइव इसको हटाओ, इसको हटाओ। अभी भी नजर आ रहा है ना? मैं भी चाहती कि ये नजर आए। ओके, सो गुड इवनिंग एवरीबॉडी। मैसेजेस नो, हाउ कैन आई रीड द मैसेजेस? है कितने लोगों ने ज्वाइन किया हुआ? कितने लोगों ने ज्वाइन किया हुआ? सो गुड इवनिंग। आई होप आप लोगों को शायद पता लग ही रहा होगा, फर्स्ट टाइम लाइव आई हूँ मैं, फर्स्ट टाइम लाइव स्ट्रीमिंग है, तो थोड़े से इश्यूज हो सकते हैं मुझे, बट excuse me for that. But anyways, let's begin our session. So first of all, I would like to thank God that इतनी ब्यूटीफुल ब्यूटीफुल जो स्ट्रीम है उसमें हमें लेकर आए, और जो कुछ भी मैंने अपने गुरुओं से सीखा है, मैं अपने गुरुजन को भी बहुत बहुत प्रणाम करती हूँ। जो कुछ भी अपने गुरुओं से सीखा है, कोशिश करूंगी कि वही मैं आपको भी ट्रांसफर कर सकूं। तो सबसे पहले बहुत सारे लोग मुझे कह रहे थे कि एग्जाम से पहले मैम प्लीज एक बार ये क्लास ले लीजिएगा। कोई पर्टिकुलर अगर आप लोगों को क्वेश्चन है तो वो पूछ सकते हैं, अदरवाइज किस तरह का एग्जाम सेट होगा मैं उसके ऊपर बात कर सकती हूँ। व्हाट डू यू से, यू हैव, अब यू कैन पुट इन चैट, चैट में बता सकते हैं अगर कुछ पर्टिकुलर आपको पूछना है तो मैं उसके ऊपर बात कर सकती हूँ। आपका फेस आ रहा है इसमें। एनीथिंग यू वांट टू आस्क? वेरी गुड इवनिंग। कुछ आपको पर्टिकुलर पूछना है तो यू कैन पुट इन द चैट बॉक्स ताकि मैं उसका ही आंसर दूं, अदरवाइज किस तरह का एग्जाम सेट होगा वी कैन टॉक अबाउट दैट। प्रोटोकॉल ऑफ व्हाट? टीबी? प्रोटोकॉल ऑफ टीबी कभी भी आपके एग्जाम में नहीं आएगा, डोंट वरी अबाउट इट। एनीथिंग एल्स? एनीथिंग एल्स? So what is there in your syllabus? first of all we should see what is there in your syllabus. Okay, तो सिलेबस में क्या है आप पहले ये देखिए, आपके सिलेबस में सबसे पहले है त्रिदोषास, त्रिदोषास के बारे में बात करी जाएगी. ओके, सो किस तरह के क्वेश्चंस, द वॉइस इज वेरी लो. ओके, द वॉइस इज ओके नाउ, नाउ यू कैन हियर मी. Am I audible now? Am I audible? ओके, सो सबसे पहले दोषास की बात करी जाएगी. क्वेश्चन किस तरह के आते हैं? वेरी इजी क्वेश्चन. क्वेश्चन को एक्चुअली सबसे इजी क्या है, सबसे इजी आपका एग्जाम है. बिकॉज यू आर फॉर्चुनेट इनफ, आपके एग्जाम में क्या है, मल्टीपल चॉइस क्वेश्चन है, आपको 4 ऑप्शन मिलेंगे, एक को टिक करना, दैट्स इट. एंड हमारे टाइम पर तो इतना कुछ लिखना पड़ता था, तो आप लोग तो बहुत लकी हो. एनीवेज, तो सबसे पहले ये पूछेंगे त्रिदोष में क्या होता है, व्हाट आर द थ्री दोषास. सो व्हाट विल बी द आंसर, द आंसर विल बी व्हाट, वात पित्त एंड कफ. इस तरह के क्वेश्चन आते हैं. तो फिर जो सेकंड क्वेश्चन आ सकता है, जो सेकंड क्वेश्चन आ सकता है वो ये आ सकता है, वात कंसिस्ट्स ऑफ व्हाट, विच टू एनर्जीज. तो क्या इस तरह के क्वेश्चन आते हैं ऑप्शन में, 2+3, 1+2, 3+4, दैट वे. सो इन दैट केस व्हाट विल बी द आंसर, कैन एनीबॉडी आंसर, व्हाट विल बी द आंसर, वात कंसिस्ट्स ऑफ व्हाट. In the chat down, in the chat write down. 1+2, 2+3, what? What consists of which two energies? Which two energies? 1+2. Very good, Rishi. Okay, okay. Charu. Okay, fine. Okay. What consists of 1+2? Such questions come. And the pith is what? 3+4. And what about kapha? 4+5. This way they will be asking you the questions. So that is not difficult at all, as far as I think. Okay, then what else can be asked, how many types of vata doshas are there, how many types of pitta doshas are there, how many types of kapha doshas are there. So if they ask how many types, then obviously you have to answer 5 types. Okay, so how many types of pitta and kapha doshas are there. So for example, if one question comes like uh, Pran Vayu is a type of Vata, Pitta or Kapha. This type of question may also come, or none. Pran Vayu. So wherever the Vayu is there, means it is Vata only. Okay. Then how many types of Vayus, Vatas are there? Pran Vayu, Udan Vayu, Vyan Vayu, your Saman Vayu and Apan Vayu. Okay. Then the questions can be asked the way, this way, that what is the residence of this particular vayu. Like for example, if somebody asks the the anus comes under what, the pran vayu, udan vayu, vyan vayu or apan vayu. In that case the answer would be anus. Anus comes where, the answer would be, anybody? The vayu which is released by your Guda Dwar, by the anus, is Apan Vayu. Okay, always remember this thing. Okay, such questions are there, and it is very easy to answer. Once you know how many types of Vatas are there, just go through that, and you can see the residence of these, and it is very easy to answer. So you can find out on page number, I think it is page number 116. Let me check in the new book. Yes, page number 116. Okay. Uh, so that is actually very easy to answer. Then after that, the questions like as far as the pitta is concerned, जब पित्त की बात हो रही होगी तो वो इस तरह के क्वेश्चन पूछ सकते हैं कि आपकी पहले तो ये पित्त कितने प्रकार की है, हाउ मेनी टाइप्स ऑफ पित्ता आर देयर, सो देयर आर 5 टाइप्स ऑफ पित्ता. देन द रेजिडेंस ऑफ आलोचक पित्त is आलोचक. आलोचक पित्त means your eyesight and your vision. Okay, the eyesight and the vision both comes under the alochak pit. So you have to answer this way. Means if the question is asked like the eyes is resident of which pitta, then you can answer it is alochak pit. Okay. If some disease comes which is a skin type of a disease, like some eczema, like some poke, like some you can say acne. So they all come under the Bhrajak pit, because the Bhrajak pit is the pit which has direct concern with the skin. Okay, so this way, just remember this thing: if skin is there and the heat is there, the pitta is there, then it is a Bhrajak pit only. Same way, if some blood type of a thing is there, bleeding from anywhere is there, in that case, you have to write down it is a Ranjak Pit, because Ranjak Pit is the pit which gives color to your blood. Always remember this thing. Ranjak Pit is the pit which gives color to your blood. Means this is the pit which has relation with your RBCs, which is related to the RBCs. So in that case, you will be writing down the Ranjak Pitta is connected with the bleeding. If bleeding is there somewhere in the body, then Ranjak Pit has to be sedated. If bleeding is less, means means the blood clot is there. In that case also, the Ranjak Pit is the pit which has to be treated. Okay. Uh, I think I am audible now. What do you say? Am I audible? Are you able to hear me? Yes or no? Yes or no? Are you able to hear me? Please write down in the chat box. Yes. Okay. Thank you. Thank you. Okay. So going forward, when we talk about the kapha, now again, if they ask how many types of kapha are there, then there are 5 types of kaphas. Everybody knows that. Okay. Now, if it is asked that your brain, heart, and spine comes under what? Which type of kapha? Then the answer is Tarpak kapha. Such type of questions will come. It is not difficult at all. Once you go through these charts, it will be very easy for you. Okay. Then, like the salivary glands come under what? These are the questions which are asked repetitively. So that comes under what kapha? Which kapha? Can anybody answer? It is Kledak kapha. It is Kledak kapha. So it is not difficult at all. Now coming to the protocols, coming to the treatments. How do we treat? Okay. Now you see, whenever you have to treat according to Vata, Pitta, and Kapha, these three doshas, in that case, what will you be looking at? You should be knowing the attributes and the function. The attributes of Vata are what? What are the attributes of Vata? Can anybody answer in the chat box? What are the attributes of Vata? Can anybody answer? Attributes of Vata? Attributes of Vata? Please write down in the chat box. Let's not waste time. Please, please, please. Come on, come on. See, moving, rough. Very good. Anything else? Dry, rough, fast. Okay, fine. Anybody else? Anything else? Anything else? See, what I want to tell you is, see, mobility is directly proportional to Vata. Mobility. See, if the, yes, dryness is there, definitely. Okay, if whenever the patient comes to you and you see the movement is more than required anyways, somebody has shaking hands, twitching of the cheeks is very common, shaking hands is very common, shaking of the foot is very common, the twitching, the paralysis, Parkinson's, all these things come under Vata only because the movement is more than the required. Even the movement of the thoughts, wandering thoughts. One time the person is thinking about one thing, and the second moment he is speaking about something else. Indecisiveness. Reason is what? The lack of stability. Always keep this thing in mind. If that is there, in that case, definitely you have to reduce the vata. And what will be the counter energies? Water. What will be the counter energies? In that case, vata is to be reduced, and if yes, fickle minded, you're right. Why fickle minded? Why fickle minded? Why fickle minded? The person is fickle minded because he is not able to stick to anything. The absence of kapha is there. The person is not able to stick to anything. The vata is more. In that case 1 2 will be sedated. 1 2 will be sedated. And now you have to again see the attributes of that person, attributes of that disease, whether the heat has to be increased or whether the kapha has to be increased. Either 3 4 has to be increased or 5 6 has to be increased. Okay, but 1 2 has to surely be reduced only, to be sedated only. Okay, now that is there. Then after that, the vayu, the attribute of vayu is what? Vayu is dry. Dry. When the air is there in the atmosphere, your clothes will dry fast or not. So vayu have this capacity. So that is there. And vayu is light. Vayu is light. Okay. Then because it is dry and it dries the moisture also. So it will be rough also. It will be rough also. So when the person comes to you with rough skin, with something rough, with rough nature, 1 2 is more. Make sure. Okay, 1 2 is more. You have to just sedate it. Fine. Cold and transparent. Somebody has written. Okay, cold and transparent. Okay, transparent is there. That we know. We know. We cannot see vayu. Okay, that is there. we can feel it. Fine. You see, in the pitta, in the case of pitta, if you touch a person like this, the heat will be felt. Okay, but vayu, if it is accompanied with water, it will become cold. Okay, but do you know, although yes, in your books it is written cold, but you know, the heat is aggravated if the vata is more. The vata aggravates the heat, it ignites the heat, it ignites the fire. In the absence of oxygen, can the fire be there? Can the fire be there? No. Same way, it also, it uh, heat also, heat, it may spread the heat. Suppose some, if you must have seen, अगर आपने देखा होगा किसी के घर में अगर आग लग गई हो, अगर आपने कभी देखा हो, वैसे अनफॉर्चुनेट है, अगर कभी आग लग जाए थोड़ी सी और हम उसको हवा से बुझाने की कोशिश करें, तो क्या वो बुझेगी? क्या वो बुझेगी? किसी के घर में आग लग जाए तो हवा बढ़ने पर क्या वो अग्नि बुझेगी? क्या वो अग्नि बुझेगी? यस और नो? नो. ओके, व्हाट डू अदर्स से? व्हाट डू अदर्स से? नो. ओके. ओके, रेणु जी. ओके, will increase. Okay, see now, एक another case, एक दिया है जल रहा है, उसको पंखे के नीचे ले आएंगे, वो अग्नि बुझ जाएगी? कितना हम कितना एक दिया जलाते हैं, कैंडल जलाते हैं, उसको ऐसे 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 बचाते हैं थोड़ी सी भी हवा से, तो क्या होता है उस केस में? अग्नि बुझ जाएगी. The vayu can behave in both ways. Vayu can behave in both ways. It may increase the fire और it may extinguish it. वो उसको बंद भी कर सकती है और उसको इंक्रीज भी फैला सकती है, मेनी टाइम्स फैला सकती है. पूरे के पूरे जंगल जल जाते हैं अगर स्पीड में वायु हो, एक उसकी डायरेक्शन हो, उसी डायरेक्शन में आग लगेगी, है ना? तो यहाँ पर आपको देखना है, अगेन आप एट्रीब्यूट देखेंगे, आप देखेंगे कैसे बढ़ी, कैसे घटी, all these things. Okay, now even in the diseases also, उसमें भी यही है, एक वायु होती है जो अग्नि को मंद कर देती है और एक वायु है जो अग्नि को बढ़ा देती है. जिसने इसके ऊपर मास्टरी कर ली उसको ट्रीटमेंट करना बहुत इजी हो गया. सो बड़ी मजेदार चीज है आयुर्वेदिक acupressure. Ayurveda is very interesting thing. The ancient science, mother of all other sciences. It is actually very interesting. थोड़ा सा समझने की जरूरत है और मैं कौन हूँ आपको समझाने वाली. मैं अगर आपको 1% भी आयुर्वेदा समझा दूं तो वो बहुत बड़ी बात है. मैं खुद भी नहीं जानती होंगी 1% भी. इतनी वास्ट चीज है ये, इतनी वास्ट चीज है, तो दूसरों को क्या सिखाऊंगी, है ना? तो 0.1% भी अगर हम सीख पाए तो वी कैन बी सक्सेसफुल. फाइन, we will be trying to learn that. Okay, now if we talk about the kaphas, so it is on page number 132 in your charak 1. So you can go through this chart, this particular chart. In this chart you can see there are 5 types of kaphas. Okay, now in this also I think kaphas we had already covered. Yes. Now इसके अलावा अब इसमें अब और क्या क्वेश्चन आ सकते हैं? और क्या क्वेश्चन आ सकते हैं? 5 प्रकार की आपकी वात हो गई, 5 प्रकार की पित्त हो गई, 5 प्रकार की कफ हो गई, ठीक है? अब इसके अलावा ये क्या क्वेश्चन पूछ सकते हैं? मैंने एक क्वेश्चन आपसे क्लास में पूछा था, देखते हैं किसको याद है, कौन जवाब दे सकता है। व्हाट आर द 3 सब पिलर्स ऑफ आयुर्वेदा? कैन एनीबॉडी आंसर? उसके लिए क्लैपिंग करूंगी जो आंसर करेगा। कैन एनीबॉडी आंसर? व्हाट आर द 3 सब पिलर्स ऑफ आयुर्वेदा? कैन एनीबॉडी आंसर? थ्री सब पिलर्स, सब पिलर्स, सब पिलर्स। कैन एनीबॉडी आंसर टू दैट? वात पित्त कफा आर 3 दोषा, सब पिलर्स, सब पिलर्स। चैट बॉक्स में लिखिए, जल्दी जल्दी लिखिए। व्हाई शुड वी वेस्ट टाइम? Food, very good. What else? You see, yes, you see, in Ayurveda, a lot of emphasis have been given on how you lead your life. Actually, what is Ayurveda? What is Ayurveda? Is Ayu and Veda means knowledge of life. So, uh, if we study about Ayurveda, then we always have to see how you lead your life. It will it will decide what your life will be, how your life will be. Hetuling Aushad is not 3 pillars, sorry to say. Hetuling Aushad, somebody has answered, no, that is wrong actually. Okay, there are the 3 sutras. Okay, so what I mean to say is, in Ayurveda we study about how you lead your life. So your vihar, your vichar, and your nidra, these decide what type of person you will be becoming. Okay. So your ahar, what type of ahar you should be having? You should be intelligent enough, prudent enough to know what to eat and when to eat. It is very important. The regional as well as seasonal vegetables are the best one to eat actually. Then if somebody is going for example, somebody is going for workout and all, maybe requirement of his body is entirely different from a person who is leading a sedentary lifestyle. Okay, so in that case the proteins are more needed, whereas the other person may be needing more fibers. So that way, knowledge of what you eat is very important. Your ahar is very very important. So in general you should be taking a balanced diet, a regional as well as seasonal food. I can actually talk about this ahar for a long time. If you must have heard about your hit book, if you know about it, or some other time we'll be talking about it. This is very interesting topic of Ayurvedic acupressure. If you are interested, I can take more classes on this, and we will be talking in details about this. But right now, we are just covering the major things. The the main thing was your ahar, and then is your vihar. What is vihar? What is vihar? The lifestyle, the routine. Your routine is utmost important. How you begin your day. Just a moment, please. How you begin your day And what you do, what do you do, how do you spend your day? Do you really go for any exercise? Do you really go practice yoga? Okay, what is your, how much stress you take, how much in these days, how much is your screen time? That is also your vihar. How you behave with others, how you behave with the people who are uh, below your standards, if you say like that. Okay, your behavior, that is very important. Then the third thing is your vichar, your thinking, your attitude. So that is very important. Your thought, your mindset, your mindset. What type of thoughts conquer you? What types of thoughts come in your mind generally? Okay. Actually, I know that one cannot think in one particular way only, but mostly what type of thoughts come, that will also make you, if you have good vichar, definitely your health will also be good. आकाश वायु अग्नि जल पृथ्वी के साथ साथ चलते हैं काल दिशा मन आत्मा और तम, मन चंगा तो जग चंगा. So your vichar are really very important. So the ahar, vihar, vichar, and the fourth thing was your nidra, your nidra, your sleep, sleep time. If your sleep is good, if you sleep like a child, then you will lead your next day like a healthy individual. If your sleep is disturbed due to any reason, then obviously it will be affecting your other elements also. So आहार, विहार, विचार और निद्रा, ये सारे बहुत जरूरी हैं आपके लिए. तो अभी हम बात कर रहे थे सब पिलर्स की. जो सब पिलर्स हैं उनमें से आपका जो आहार है और निद्रा, दो तो इसी में से आ गए. ठीक है, योर आहार, योर फूड एज वेल एज योर स्लीप आर टू पिलर्स, एंड द थर्ड and the important pillar was the brahmacharya, your brahmacharya. So brahmacharya means the discipline, your lifestyle discipline. Brahmacharya does not mean that you don't have to get married. It does not mean that. It means that you should be knowing your how much activity is adequate. You have to watch your behavior. Okay, so that is there. So balance your work, your relationship, your exercise, your screen time, and excess of each and everything is bad. So as therapists also, as the therapists of Ayurvedic acupressure or TCM, what we know, we know only we know only how to balance these energies only, if you understand. In TCM, what we see? In TCM, what we say? Wind, fire, earth, and then wind, fire, earth. Then is what? What is next? Anybody? Answer? Wind, fire, earth, then metal, and then water. All these things, they have to be balanced, and there is a certain typical way in which they can be balanced. For example, sometimes the grandmother balances it, sometimes the mother balances it. That is there. So you must be remembering those cycles. Okay. Now, in the case of Ayurveda, we see Akash, Vayu, Agni, Jal, Prithvi, and then 5 metaphysical elements also: Kal, Disha, Man, Atma, and Tam. So whenever the imbalance is there in these, only then the ailments come. So what we know as therapists, we know nothing, only we know how we can balance these. So when you have to make the protocols, you have to see the type of disease. If the vata is more, 1 to sedate, 5 6 tone, sometimes the pitta has to be increased. In that case, you will come to know on touching the patient, on touching that particular part. If it is very cold, then pitta has to be increased. Otherwise, generally the kapha is the counter energies. If the pitta is more, then either 3 6 sedate or 3 4 sedate. If especially in the case of bleeding, 3 4 sedate, 5 6 tone. Otherwise, 3 6 sedate, sometimes 2 4 tone. Okay. If the kapha is more, definitely 4 5 sedate or 5 6 sedate. And the counter energies are 1 2 tone. Suppose something is there, if I talk about the kapha, if something is there stable, suppose some node is there, suppose the corn is there on the foot, in that case, 1 2 will be tonified. 1 2 means the vata has to be increased, it has to be dried, only then it will fall. 1 2 tone, 5 6 sedate. Okay. And the other cases, in other cases, what happens? What happens? 4 5 sedate and sometimes 3 6 tone. 3 6 tone, 4 5 sedate is the most used protocol in Ayurvedic acupressure. I must tell you. 0 3 6 tone, 4 5 9 sedate to be, if I be specific about it. 0 3 6 tone, 4 5 9 sedate is the most used protocol. Okay. Now, this thing is covered. Now, shall I move forward? Shall I come to dhatus or not? What do you say? Did you understand what I wanted to tell you? Did you understand what I wanted to tell you? I think in this live stream, the messages are coming late. In Zoom, we can immediately know what other person wants to tell. We understood. Okay, 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 okay. Okay, fine. Shall we talk about the doshas? Sorry, the dhatus, the tissues. Are you comfortable with my language? आपको मेरी भाषा समझ में आ रही है? मैं हिंदी में ज्यादा बोलूं या इंग्लिश में, आप मुझे बता सकते हैं, या मिक्स चलेगा? आप लोग इंग्लिश में या हिंदी में किस में मोस्ट कंफर्टेबल हो, या दोनों मिक्स चलेगा? ओके, ओके, थैंक यू फॉर दैट. ओके, so dhatus, page number 150 in your books. It is page number 150 in your books. Let me open that. Huh. So dhatus are there. So dhatus, very interesting and very easy to understand. मैंने आपको क्लास में भी बताया था. I told you in the class as well. So first of all, right index finger, ras, rakt, mas, med, asthi, majja, then shukra, ojas. You should be remembering this. You should be remembering this. Ras, rakt, mas, med, asthi, majja, shukra, ojas. Do with me, everybody. Do with me. Ras, rakt, mas, med, asthi, majja, shukra, and ojas. Okay, why I am telling you to do this? First of all, it will be helping you in the practice also, in the clinic also, because these things at least you should be knowing. You should not be able. You should not open books once again and again for these small things also. Now you know if some skin disorder is there, then you will be treating on mass, means means right, small finger. So the questions which come to you in the exam, sometimes, not sometimes, I mean, at least 5 questions will come in which they will be asking you which tissue comes on which finger. So now it is so easy for you. For example, if it is asked, if it is asked, uh, your your plasma tissue come on which finger, then you have to answer it is on right index finger, pick the joint. Very simple. Now, for example, your I mean, shukra. The shukra comes where? Now you know it is on your left middle finger. Pick the joint. So very easy. So if you remember these things by heart, you will be able to answer very easily. आप बहुत easily answer कर पाएंगे. ठीक है, तो ये तो हो गए, ये तो आपको अच्छे से याद हो गया. अब उसके बाद क्वेश्चन आता है कि आप इनके जो होते हैं ना, इनके उपधातु क्या होते हैं? व्हाट आर द बाय प्रोडक्ट्स? द बाय प्रोडक्ट्स. तो इसलिए आपको अब याद करना पड़ेगा. जैसे कि रस का बाय प्रोडक्ट है म्यूकस, है ना, और मांस का है रस का उपधातु है द मिल्क एक्चुअली, और म्यूकस उसका मल है, मल. So this you have to see in page number 150. 150 पेज नंबर 150. इसको आप 10 मिनट्स भी दे देंगे इस टेबल को, you will be able to do it very easily because मल्टीपल चॉइस क्वेश्चन आने हैं, सब इसी टेबल में से आना है, बाहर से कुछ नहीं आना. जो मैंने आपको बाकी पढ़ाया वो एक्स्ट्रा नॉलेज दी है, दैट इज अनदर थिंग, बिकॉज यू शुड बी नोइंग. अदरवाइज अपने आप से टेबल पढ़ना डिफिकल्ट होता है, तो एक नॉलेज तो हमें देनी ही होती है. बट आपका जो क्वेश्चन सेट होगा वो इसी टेबल में से होगा, तो आपको बिल्कुल भी कोई भी किसी भी तरह की टेंशन लेने की जरूरत नहीं है. बस आपको केवल यही पता होना चाहिए, whatever you eat, whatever you eat is really really very important. If you eat garbage, it will lead to garbage, it will lead to bad tissues in your body. If you eat, by garbage I mean the fast food, the junk food, the food which does not have any nutrition. Okay, it will, you know, many people are dying these days in North India. Why? Because of this, because of the contaminated water and contaminated food. A lot of heat is there outside these days, you know. Now rus is extracted, the rus, your plasma, is extracted from the food you eat. Okay, then रस से ही रक्त का निर्माण होता है. the the blood, your blood is your blood is made from the from your plasma only. Blood is made from the plasma only. Okay, so what is the difference between blood and plasma? Please write in the chat box. Anybody? I've told you in the class itself. What is the difference between blood and plasma? ये हट नहीं सकता. आओ फिर मैंने क्या करना. What is the difference between blood and plasma? ये नहीं चाहिए मुझे, मेरी फोटो चाहिए. मेरी है ही नहीं, ये नहीं दिखाना. Write down in the chat box. Plasma is without RBCs. Okay. Plasma is the blood minus RBCs. Okay, that's the right answer. Very good. Okay. So the quality of your blood depends upon the quality of the plasma. And your plasma, the quality of your plasma depends upon the nutrition which you take through your food. What you eat is what you become. What you eat is what you become. Okay. So Rakt then is your mass. Your mass. Mass is what? What is mass? Can anybody answer? Can anybody answer? Your muscles, your twacha. Twacha is what? Skin. Both come under the mass. Okay. So the mass also, the good quality of mass also depends upon the quality of the quality of the blood. Quality of the blood. Okay. Okay. Then select the mass. Then is made. What is made? What is made? The adipose. The adipose tissue. The adipose tissue. So your adipose tissue again depends upon the mass, depends upon the skin. Okay. Now the skin was what? The skin came from the blood, and blood came from the plasma. Okay. Now in the same series, after adipose tissue is your asthi. Asthi is what? Bone tissue. Your bone. The bone. Your bones should be hard, strong, or soft. The bone should be soft or hard. Strong. The bone should be soft or strong. Write down in the chat box. Asthi. Asthi should be strong. The strength of your bone now depends upon again the previous tissues. The strength of your bone now depends upon the previous tissues. Akash, sorry, not Akash. It is on Ras Rakt Mass made. Okay. Now, in the uh, large bones, in the big bones of your body, resides your bone marrow. Resides the bone marrow. And in those उसी बोन मैरो में क्या होता है आपके आरबीसीज डब्ल्यूबीसीज आपके जो क्या कहते हैं एरिथ्रोसाइट्स आपके ल्यूकोसाइट्स और इसके अलावा आपके प्लेटलेट्स थ्रोम्बोसाइट्स ये सब यहीं पर जन्म लेती हैं तो कितना ज्यादा जरूरी है अच्छा बोन मैरो होना है ना कितना ज्यादा जरूरी है लेकिन वो अकेला हो ही नहीं सकता आपका बोन मैरो अच्छा हो ही नहीं सकता अगर आपकी बोन स्ट्रांग नहीं थी क्योंकि उसकी रेजिडेंस क्या है उसका घर क्या है बोन है ना बोन कहाँ से आया बोन कहाँ से आया रस रक्त मांस मेद से है ना तो इसीलिए इसीलिए हमें इस चीज का भी ध्यान रखना है कि हम जो भी खाना खाएं वो हमारे टिश्यूज को प्रॉपरली नरिश करें वो हमारे टिश्यूज को बनाने में हेल्पफुल हो ठीक है और दैट विल लीड टू good quality of that will lead to good quality of शुक्र your reproductive tissue अच्छा तो देखिए to obtain that particular शुक्र to obtain that particular शुक्र सिर्फ वो करने के लिए ही ये पर्टिकुलर एक टिश्यू आ जाए इसके लिए ही इतने सारे टिश्यूज पहले बिल्ड हुए यू नो कोई भी लिविंग बीइंग होता है उसका एक मोटिव होता है उसका एक मोटिव होता है अपने जैसे ऑफस्प्रिंग्स पैदा करना अपने जैसे और लिविंग बीइंग्स पैदा करना है ना एक आदमी आदमी को जन्म देगा एक डॉग डॉग को जन्म देगा, मैमल्स जितने भी हैं। तो क्या है उसका सोर्स, क्या है? द रिप्रोडक्टिव टिश्यू, द शुक्र। अब शुक्र में क्या आ जाएगा, शुक्र के अंदर क्या आ जाएगा? इसमें अगर मेल की बात करें तो टेस्टिकल्स भी आ जाएगा, फीमेल की बात करें तो श्रोणिका। ठीक है, तो सिर्फ ये ऑब्टेन करने के लिए सारे धातु बने। कैन यू बिलीव दैट? इजंट इट वेरी इंटरेस्टिंग? Please explain in English. Okay. I think I was talking in English only. Maybe probably I have missed some word. I will sum up in English also. Don't worry. Okay. So what I was saying is, just to obtain the reproductive tissue, which is actually essential to give birth to the offspring of its of man's own kind, all other tissues are important. Means your ras, rakt, mas, med, asti, majja all take place just to bring about this particular tissue only. Okay. Now here comes what I was talking about, the brahmacharya. The Now you should be watching your behavior. Excess of everything is wrong. You know, if this particular tissue is excreted in more quantity, more frequently, then it will take away all other tissues. Means your bone marrow, your bone, the muscle, the adipose tissues, the blood, the plasma, everything will be suffering because of this wrong behavior. So this behavior is also very important. I think you understood now in English also. So if you don't understand, you can go through my class. I think I had given, I think 3 hours to this table. And it is really very, very interesting to know how it works. So, anyways, this is about the tissues. Now, let's come to the mega meridians, which was the third topic of semester 3. Okay, mega meridians. Uh, Before I switch to mega meridians, please let me know this much was clear with everybody. What I was telling you, that much was clear. Yes, ma'am, understood. What about others? What about others? Is it clear to everybody? Am I able to make you understand what I want to? Clear? Okay. 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 Now the next book is your next book is Atre. Your next book is Atre. Okay. So in Atre, what we study is we study about the mega meridians. The mega meridians. The mega meridians, it is important because such questions also come in your books. Mega meridians are known as sea of energy. Okay, it is known as sea of energy. Why? Why? Can anybody answer? Why it is known as sea of energy? Can anybody answer? Why is it known as sea of energy? Can anybody answer why the mega meridians are known as seas of energies? Please write down in the chat box, in the comments. Write down, write down. All meridians pass through. Okay, any other answer? Any other answer? All meridians of legs and hands pass through. Okay. Any other? Only for Shukra, one should take good food and not for own health. Uh, your health, actually, this is what is the question? Not for good health, only for Shukra. No, 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 no. You've taken me wrong. You've taken me extreme wrong. These tissues are what you are. These tissues make you what you are. Okay? If these tissues are in balance only, then you have good health. Let me tell you, your good health is what? These tissues only. In a If you go in the broader spectrum, then you can say it is good health. But I am telling you in details. I'm breaking it down into different segments in different tissues. They all lead to good health only. Fine. Most meridians pass through wrist area, therefore the area has done. Actually, each mega meridian is, they are actually um, equivalent to 100 to 150 AQ points. 100 to 150 AQ points, because they are compared with the chakras. They are compared with the chakras. The most dense energy reside here on the chakras as well as the mega meridians. Okay, so that is why they are known as the seas of energy. Lot of energy is there. So if you master mega meridians, you will be able to treat most of the diseases very easily. Fine. Can you please explain in short when to choose which spiral number, LVM, LHM, RLHM? I can explain. I can remind me later on. I can explain why not. Because there is lot of energy at the wrist. Yes, lot of energies are there on your wrists as well as on your ankles. So that is why these are known as the mega meridians. These are known as the seas of energies. The dense energy is present over here. Very simple, and this particular answer will at least give you 2-3 marks in your exam. Okay, because such questions are also very simple. Question paper is there. Fine. Now you all must be knowing which particular mega meridian comes where. For example, if I talk about the LMM, then here is 0 and here is 9. On the thumb side is 1, 4, and here on the yin yang border is your 5. Whereas away from the thumb on the small finger side is your 2, 3, and here on the yin yang border is your 6. At the back, at the center is 9, and on the thumb side is your 8, and away from the thumb on the small finger side is your 8. So that is very easy to do. Okay. As far as the branch treatment is concerned, I have already uh, talked about it in details in your classes. Okay. So generally, uh, the questions about the mega meridians, generally the questions about the spine are asked. For example, if you have to treat your cervical, then which mega meridian will be, on which mega meridian will you be giving the treatment? Can anybody answer? For vertigo, which mega meridian will you be choosing? Can anybody answer to that? For vertigo, which RMM will be treated? Can anybody answer to that? RMM 9. Okay. Yes, you're right. Not 7. Vertigo, actually, vertigo, why does the vertigo takes place? Because the nerve which comes between C1 and C2 is affected. There can be protrusion, there can be uh, probably your osteophytes are there, whatever the problem is. So the atlas and the what is the second axis? Your atlanto-axis nerve in between the atlas and axis means nerve number cervical number 1 is affected. So now you can remember it like this. Go from below to top. Okay, for the for your tailbone coccyx, 0 number is there. Okay, okay. Then after that is your sacral. Then 0 1, that way. And when you go further, for example, for the lower back, this question generally comes either they ask in the viva or it comes in the exam. For lower back, you will be treating on what? Which RMM? Lower back will be treated on RMM 7-8. Okay, lower back will be treating on RMM 7-8, and the coccyx, the tailbone, will be treated on RMM. Lower back was not 7-8, sorry, 1-2, 1-2, because you have to go from the bottom to top. Okay, and coccyx will be treated on the coccyx will be treated on 0. Okay, so on 0, if suppose the pain is there in the coccyx, then what treatment can be given on RMM 0? Write down, write down the treatment. If the nerve is compressed at the tailbone, RMM 0, 2, 4 sedate, 3, 6, 7 tone. 2, 4 sedate, 3, 6, 7 tone. Same way, after that, these the lower back, then the upper back, means your cervical area. In that case, the cervical area, you can take RMM 7-8. Okay, for cervical 7-8. If suppose they ask the shoulder pain or the arm pain, in that case you should be knowing that the nerves which are coming from your C6, C7, C7, C8, that supplies to your arms. So in that case you will be choosing RMM 7 and 8. Okay, because that is radiating to arm. The nerve which is being compressed at C7 C8, जो nerve C7 C8 पे compress हो रही है, वो ही radiate होकर supply दे रही है आपके हाथ को, आपकी बाजू को, आपके कंधे को. So in that case आप इसको 7-8 पर ट्रीट करेंगे. ट्रीटमेंट वही रहेगा 2-4 sedate. अगर ज्यादा पेन है तो 3-6-7 टोन. अगर पेन लगातार कई दिनों से बना हुआ है तो 2-4 sedate, 3-7 टोन. ओके, दैट इज द प्रोटोकॉल विच यू हैव टू चूज. और अगर चक्कर आ रहे हैं तो RMM 9 पे ट्रीट करेंगे. RMM 9 पे ट्रीट करेंगे. ठीक है, तो उसका प्रोटोकॉल क्या होगा? 1-2 sedate, 5-6 टोन भी हो सकता है. ओके, कुछ केसेस में 2-4-5 sedate, 3-7 टोन भी हो सकता है. मेक श्योर RMM 9 जो है वो जरूर यूज करेंगे इसमें. वो यही जानना चाह रहे हैं आपसे, ठीक है। और चक्कर के साथ साथ सर्वाइकल स्पॉन्डिलाइटिस है, तो उस केस में आप RMM 7, 8, 9 तीनों को लेंगे। ओके, सो इस तरह से आप चूज कर पाएंगे, इस तरह से, यस और नो, इस तरह से चूज कर पाएंगे। Yes or no? Please write down in the chat box. Yes or no? Okay. Good. Good to know. Good to know. अभी मैंने आपको थोड़ा डिटेल में पढ़ाया था EAV को कैसे कन्वर्ट करना है मेगा मेरिडियन में। लीव दैट, वो सिर्फ आपकी नॉलेज के लिए था। मुझे नहीं लगता उसमें से कोई भी क्वेश्चन आएगा एग्जाम में। एज फार एज द एग्जाम इज कंसर्न, मैं कभी भी एग्जाम्स के हिसाब से स्टूडेंट्स को नहीं पढ़ाती हूँ। मैं पढ़ाती हूँ आपके जो काम आएगा, जो आपकी प्रैक्टिस में काम आएगा, उसके अकॉर्डिंगली। तो कोई बात नहीं, अभी एग्जाम के लिए उसको लेने की जरूरत नहीं है। एग्जाम उससे इजी होता है, जो पढ़ाया है उससे इजी होता है। तो इसमें किस तरह के क्वेश्चन आ सकते हैं? राइट ईयर का ट्रीटमेंट होगा, RMM पे होगा या LMM पे होगा? वेरी सिंपल। Okay, should I repeat the protocols? I will repeat it. Okay, I will repeat it. So what I was saying is right ear, right nostril, right eye, right kidney, इस तरह के क्वेश्चन आ सकते हैं। Such questions can come. They will be treated on RMM. Left ear, left nostril, left kidney, your spleen, all these things will come on the LMM. Okay, on the LMM. Left one will come on LMM. The upper one will come on LMM. The lower part will come on RMM. The front part will come on RMM and the back part will come on LMM. Such things to be remembered, and it is very easy to remember. Okay. So you were asking me to repeat the protocols for the compression of the nerves. If the pain is lot of pain, is it is accompanied with lot of pain, 2, 4, 5 sedate, 3, 6, 7 tone. 2, 4, 5 sedate, 3, 6, 7 tone. Otherwise 2, 4, if the option is 2, 4, 5 sedate, 3, 7 tone, then that can also be given. 2, 4, 5 sedate, 3, 7 tone, that can also be given. For circulation anywhere, for the blood circulation, the protocol will be 0, 3, 6 tone, 4, 5, 9 sedate. Write down. For blood circulation anywhere, 0, 3, 6 tone, 4, 5, 9 sedate. Okay. For stagnation anywhere, 0, same protocol, 0, 3, 6 tone, 4, 5, 9 sedate. Okay. So that is there. Yes. Another thing, your color chart. You should be going through the color chart also. Such question may also come. For example, they can ask you to reduce the heat. To reduce the heat, what treatment can be given on RMM? So in that case, on RMM 3, heat is 3 numbers is pertaining the heat. Then how will you reduce the heat? Which color will reduce the heat? Please tell. Which color will reduce the heat? Such questions can come in your Viva. If I take your Viva, I will ask such questions, I'm sure. If I happen to take your Viva, then I will ask these questions. Which color will reduce the heat? Green. Very good. Very good. This is Ashish Agarwal. Ashish Agarwal, you are answering lot of questions. I appreciate that. Rishi also. Then Amulya. The Deepti blue, black. No, Deepti blue. Blue will increase the heat actually. Okay. Okay. Anybody else? Okay. Green is there. Green is to sedate the heat. Okay. So you have to sedate number 3. So green is there. or you can tonify number 4, then green is there. Black will not solve the purpose. Please do not write black. Okay. Anything else? Now this thing is there. Such questions will be coming. I think if you study this way, then you can do anything. Any question can come and you can answer it. So anything else you want to ask, you can put in the chat box. I'll just answer how much time we are left with. It is already 8:14. So by 8:20, I will be leaving the class. So you can ask if you want to ask anything. You have 6 minutes with you. You can write down in the chat box. I'll just answer it. Please write down in the chat box if you have any confusion, any query. I can answer to that. Please write down in the chat box if any query is there. And another thing, please write down because already the messages are coming late. Okay. So if you want, I should take more classes of yours, then also please let me know. We can go through that. Renu Dhiman, ma'am, can you also explain how we choose the spiral meridian LVM LHM? Okay. देखिए आपने शुरू में ही पढ़ा होगा जनरली क्या होता है जो यांग टाइप की डिजीज होती हैं all the diseases which are of yang type, the organ is the yang organ, means the organs which come here on your vat joint. In for those particular organs you can take the vertical meridian. That is a thumb rule. For the organs which are coming on the kapha joint, means your yin organs, you can choose the horizontal meridian. That is one answer. Okay. Then spiral meridians are chosen when both the structure as well as function of the organ has been disturbed. If the function is disturbed, you will be choosing another answer to that. If the function has been disturbed, you will be choosing the vertical meridian. Okay. If the structure have been disturbed, you will be choosing the horizontal meridian. If the parenchymal diseases are there, the structure as well as function have been disturbed, then the spiral will solve the purpose. Fine. That is the second answer. Please answer for protocol asked in old papers for tuberculosis. Can anybody else answer? Because I don't remember that particular uh, protocol, tuberculosis. Can anybody answer to that? Because you must have written it. Okay. So, any other query? Any other query? Deepti is writing for pith, you select the spiral. For vat, vertical. For kapha is your horizontal. Yes, in many cases this way also. Yes, it is infinite. Ayurveda is infinite. Many ways to do treatment. Okay, Renu Dhiman. Yes, ma'am, but how we select spiral number or LVM? Now again, spiral number. Now again, this is what I was saying. It is infinite. Sometimes you have to select according to the region of the body. For example, some disease is coming on the right side. Then you have to select accordingly. Suppose vertical 1, vertical 4, vertical 5, vertical 2, 3, that way. This is one of the ways. The another ways is you should have to understand the nature of the disease. For example, some vata disease is coming. You have to select 1 and 2. The pitta is more. Pitta disease, Pitta type of disease is coming. Then 3 and 4 you will be choosing. Kapha type of disease, then 5 and 6 or 4 and 5 will be chosen. That is also there. This way. TB is written on the Hippocrates 1 page 149. Spiral. Please repeat for spiral. Somebody is asking. Okay. That is Charu Mitraj. Okay. Charuji, Charuji, Charuji. For spiral, I said when the function as well as the structure of the organ is disturbed. In that case, spiral can be chosen. Okay. In that case, spiral can be chosen. This is what I was saying. In the degenerative cases, we choose the spiral. Another answer to that. Please explain opposite flow. Explain opposite flow. You see, I'm just giving you one example. This is index finger, for example, vertical. This is 0 and this is 9. From here, this is your home and this is your office. You have to leave your home. Okay. Then this joint is your petrol pump. You take petrol from here. Then from 0, 1, 2 is here. From here you take the petrol. Then another petrol pump is at 6. Then in between there are 4 and 5. Okay. Then after that 7, 8, and this is the office. Okay. Now when you come back from the office, then this is your the destination is 0. So from then you will be beginning from your office, then this will be your 0, and your 6 means 0, then 1, 2, 6 will become your 3. This petrol pump which was on 6 will become your 3. Then 4, 5, and this petrol pump which was your 3 will become your 6. And after that it will be 7, 8, and your home will become your 9. Same way, this same way can be applied on your horizontal also. 0 will become 9, 9 will become 0, 1 will become 8, 8 will become 1, 2 will become 7, 7 will become 2, 3 will become 6, 6 will become 3, 4 will become 5, 5 will become 4. This have to be followed everywhere, even in the spiral. Thank you. Okay, you understood, Renuji. What else I need? My pleasure. Anything else you want to ask anybody? Anybody wants to ask anything? You can ask me, and after that, I'll be leaving the class. Okay, please answer to this. Is this particular session helpful to you? If it is helpful, I can take more classes. Is it helpful to you? Is this particular session helpful? Can we more classes for discussion and treatment protocol in Hippocrates? Thanks, ma'am, for very nice class. Okay, we can देखिए क्लासेस तो हम और ले सकते हैं, लेकिन मैं आपको एक बात बताऊं, किसने पूछा है हिप्पोक्रेटस डिस्कसिंग प्रोटोन? दिस इज रेनू धीमान। रेनू जी एक बात बताती हूँ मैं आपको, जो आपका हिप्पोक्रेटस है वो आज से, मैं जब पढ़ती थी 11 साल पहले तो मैंने ही ली थी वो बुक, उससे कितनी पुरानी है, उसके बाद और कितने अच्छे प्रोटोकॉल, हम तो अब हिप्पोक्रेटस खोलते भी नहीं है। ये सिर्फ उनके लिए जो नए नए लर्न कर रहे हैं, ठीक है। तो उसमें बड़ा क्लियरली सब दिया हुआ है, अगर आपको कुछ सीखना ही है तो आप इसको प्रॉपरली क्यों नहीं सीखते, आप बेसिस क्यों नहीं सीखते किसी भी चीज की, है ना। तो ये सब चीजें तो बहुत इजी हो जाएंगी आपके लिए। प्लीज टेक अ टेस्ट ऑल्सो इन बिटवीन। Today I was taking that. Okay. Shall I ask you some questions? Will you be able to answer? Yes or no? Just write down in the chat box. For another 15 minutes, we can take that. Shall I ask you some questions? Yes or no? Shall I ask you some questions? Yes or no? But I want prompt replies also. Yes, 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 yes. Oh, everybody is ready. That's great. So nice of you. Okay, okay, okay. So can anybody tell what is the residence of Avlambak Pitta? Avlambak Pitta. Avlambak Kaf, sorry. Answer, answer. What is the residence of Avlambak Kaf? Chest, heart. Very good. Chest, heart, lungs. Okay, good. Okay. Now, in another way, they can ask if some breathing issue is there, then which particular kapha is responsible? Now the answer will be Avlambak. Okay. एक एक क्वेश्चन पीछे पीछे पेपरों में देखते हो, उसके आंसर ढूंढते हो, वो अच्छी बात नहीं है। उससे क्या होगा, उससे क्या होगा, आप इस तरह से लर्न करिए ना। अवलंबक आ गया तो ब्रीदिंग इशू आ गया, तब भी आपको वही आंसर देना है, ठीक है। तो इसको इस तरह से लीजिए। अच्छा, आपके जो बोन जॉइंट है वो किस पे आएगा, कौन से कफ पे आएगा, कौन सा कफा है, बोन जॉइंट, बोन बोन जॉइंट। श्लेष्मक कफ, ठीक है, ठीक है। दिस वे। अब किसी को अस्थमा है, इस किसी को अस्थमा है, तो कौन सा वाला कफ डिस्टर्ब है, एस्मा, अस्थमा। Can we have it in on WhatsApp, so can interact will be more convenient on WhatsApp. Right now actually I have to go home also, I'm in my office right now. It's difficult now, just these few questions if you can answer. Then okay, what can be protocol for to decrease the pith and increase the kapha? What can be the protocol to decrease the pith and increase the kapha? Yes, Avalambak is right answer, Rishi. Very good. To decrease the pith and increase the kapha. Very nice, everybody. This Deepti ji, Fatima ji, Shesha Grewal. Okay. Protocol, please. Protocol, please. Protocol. Please do direct classes. What do you mean by that? I did not get you. Please do direct classes means what? You want offline? 3-6 sedate, 4-5 tone. Very good answer. Very good answer. Anybody else? 3-4 sedate, 5 tone. Good answer. 3-6 tone, 4-5 sedate is wrong. Think again, think again. I said to reduce the pitta and increase the kapha. Deepti ji and Rishi ji, you are right. Renu ji, please think again. In the case of infection, 3 has to be tonified or sedated. In the case of infection, 3 has to be tonified or sedated. Please answer. In the case of infection, 3 has to be tonified or sedated. Agni has to be tonified or sedated in infection. Tone. Amulya is saying tone. Tonified in case of infection, Renuji. Ashish Agarwal is saying sedate. Then Deepti ji is saying tone. Rishi ji is saying tone. What else? Anybody else? Anybody else? Why tone? Can anybody answer? Why tone? Most of you are saying tone, tone, tone. Only one person is saying sedate. Why tone? Already infection is there and you are tonifying the Agni also. Why tone? Can anybody answer? Can anybody answer? Why tone? In class, you mentioned that a particular temperature only bacteria can rise. Okay, then what do you do? To kill that bacteria, you will be tonifying it, right? The Agni. To kill the pathogens. Very good answer. Wonderful answer. See, no, it has to be tonified only. 3-6 tone 4-5 sedate, 0 tone 9 sedate is a very good protocol for infections. So अग्नि जो होती है ना, सी अग्नि जो है आपकी वो मुक्ति दाता है, वो मुक्ति दाता है और वो भस्म करता भी है. अग्नि मुक्ति दाता है और भस्म करता ही है. अग्नि से विनाश भी होता है और अग्नि से सर्जन भी होता है. अग्नि can give the life also. Agni can take the life also. To destroy anything, to destroy the pathogen, to destroy anything, you need Agni for that. So you need to tone the number 3 for that. Okay? अब तुम किसका चयन करते हो तुम पर निर्भर करता है. तुमने उस चीज को भस्म करना है या तुमने मुक्ति देनी है, तुमने विनाश करना है या सर्जन करना है. सब में 3 नंबर काम आएगा. दिस इज वेरी इंटरेस्टिंग. कभी हम अगर मिल सके इस तरह से कभी लाइव स्ट्रीम पर, तो हम एक एक एलिमेंट को लेकर के डिटेल में बात कर सकते हैं. ये आयुर्वेदिक एक्यूप्रेशर बहुत 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 इंटरेस्टिंग चीज है. इसकी जितनी डेप्थ में चले जाओ उतना कम है और बड़ा मजा आता है इसको पढ़कर. और एक बात मैं आप लोगों से और बोलना चाहती थी कि मैं चाह रही थी कि अब मैं थोड़ा सा यूट्यूब पर एक्टिव होना चाह रही हूँ, इसलिए आज ये करी है लाइव स्ट्रीम. दिस इज माय फर्स्ट क्लास. थोड़ी सी मुझे प्रॉब्लम्स भी आ रही हैं इसमें बिकॉज मेरे को बहुत ज्यादा नॉलेज नहीं है और टाइम भी नहीं मिला कि मैं इसके ऊपर देख सकूं। ये तो मेरे बच्चों ने मेरी हेल्प कर दी, तो आई एम डूइंग इट टू बी ट्रू, टू बी ट्रू। नाउ अगर मैं शुरू से शुरू हो जाऊं, आई मीन जो लेमैन है, लेमैन के लिए अगर हम एक्यूप्रेशर को लेकर आए इस प्लेटफॉर्म पर, सो व्हाट इज योर सजेशन? ये अच्छा रहेगा? मैं आपकी सजेशन मांग रही हूँ, आप भी मैं आपकी तरह ही हूँ, बस यही है कि कुछ साल पहले आपसे पढ़ ली, कोई ज्यादा डिफरेंस नहीं है। सो व्हाट यू से, क्या हम इस तरह से लाइव स्ट्रीम पे आए तो हम मैनकाइंड की हेल्प कर पाएंगे? क्या हम उनको एक्यूप्रेशर सिखा पाएंगे? क्या हमें आना चाहिए इस प्लेटफॉर्म पर? व्हाट यू से? आई वांट योर सजेशंस, नॉट ऑसम ऑसम, बिल्कुल ट्रू सजेशन दीजिएगा, बिल्कुल ट्रू सजेशन दीजिएगा, जो सच है वही बोलिएगा, अच्छे को अच्छा, बुरे को बुरा, आई डोंट माइंड। टू गुड, ऑसम, ग्रेट, थैंक यू वेरी मच, बट द थिंग इज, आप मुझे क्लियर बताइए प्लीज उसमें चैट में कि मैं, यस मैम, ओके रेनू जी, ठीक है, श्योर मैम, ओके वेरी गुड, आई रियली अप्रिशिएट, आप लोगों ने मेरे को सजेशन दिया, आपकी सजेशन का मैं भी पूरी इज्जत करूंगी। लेकिन जब मैं अगर आपको बोलती हूँ कि आप अपने पर्टिकुलर फैमिली ग्रुप्स, अपने फ्रेंड्स के ग्रुप्स में, अपने किटी ग्रुप्स में डालिए, आप लोगों को लेके आइए, दे शुड ऑल्सो लर्न दिस ब्यूटीफुल थेरेपी। तो क्या आप आ, हम मिलकर चलने को तैयार हैं? क्या आप इसको आगे डालेंगे अपने ग्रुप्स में, ताकि नए लोग हमारे साथ जुड़ सकें, वो भी इस पर्टिकुलर थेरेपी को, इस वंडरफुल वे ऑफ ट्रीटमेंट, इस मोडालिटी को सीख सकें? आर ऑल ऑफ यू रेडी फॉर दैट? Ma'am, if session starts from base, then definitely it will be helpful to everybody. Yes, this is what I want to uh, say. This is what I want to give actually to the mankind, to the society. I want that everybody should learn it from the beginning. Dipti ji, of course. No, I want to answer कि हम नए लोगों को ला सकें, क्या ये पॉसिबल है आप लोगों के लिए? एज थेरेपिस्ट, क्या आप लोग चाहते हैं कि ये जो पदवी है, ये जो हमारी चीज है, हमारी मोडालिटी है, ये हर घर तक पहुंचे, घर घर तक पहुंचे, ईच वन रीच वन, ईच वन ट्रीट वन, ईच वन टीच वन, इसको फॉलो करते हुए इसी श्रृंखला में, क्या ये पॉसिबल होगा आपके लिए कि हम मिलकर काम कर सकें? मैं अपने स्टूडेंट से पूछ रही हूँ, मुझे यस मैम, यस मैम, यस मैम, यस मैम, ओके। अभी तक कोई नो नहीं आया, एक का भी नो नहीं आया, सब एकजुट हैं क्या? अगेन यस मैम, ऑफ कोर्स मैम, ठीक है, वी विल शेयर इट ऑन आवर स्टेटस, दैट्स ग्रेट, बहुत अच्छी बात है, ठीक है, तो बहुत अच्छी बात है, अभी आप लोग एग्जाम दे दीजिए। आई विश ऑल ऑफ यू अ वेरी गुड, yes, yes, quite possible, yes, okay, okay, a very good luck for your exam, and I know all of you will be doing it very nicely. मेरे स्टूडेंट्स हैं, अच्छे नंबर तो लाने ही पड़ेंगे। ओके, सो ऑल द बेस्ट टू एवरीबडी, एंड अगर मुझे आपका वाइवा मिला तो आपको पता लग गया मैं किस तरह के क्वेश्चन पूछने वाली हूँ, बट लेट्स सी, डज नॉट मैटर, एग्जाम बिल्कुल मैटर नहीं करता, आपके कितने मार्क्स होते मैटर ही नहीं करता, असली एग्जाम लेगा आपका पेशेंट जो आपके सामने आके बैठेगा, वो है, वहां पर पास होना जरूरी है, ये याद रखना। सो मैं आपको ऑल द बेस्ट एग्जाम के लिए तो बोलूंगी, साथ साथ में ऑल द बेस्ट फॉर दैट पेशेंट्स, ओके। सो इसके साथ ही मैं कंक्लूड करती हूँ, अपनी वाणी को विराम देती हूँ। बहुत बहुत धन्यवाद कोप अप करने के लिए। आई वॉज नॉट वेरी कंफर्टेबल विद दिस, बट आप लोगों ने कोप अप किया, और जैसे जैसे मैंने पूछा आप लोगों ने चैट बॉक्स में भी लिखा, और मुझे लगता है कि मैं आपको हेल्प कर पाई होंगी। और आई थिंक ईएवी का अगर आपको चाहिए तो मैं आपको हेल्प कर सकती हूँ, अदरवाइज इफ यू आर ओके विद दैट तो ठीक है। अगर चाहते हैं तो ईएवी के ऊपर भी बता सकते हैं एग्जाम के लिए। इफ यू वांट आई कैन टेक अनदर सेशन फॉर दैट, इफ यू रियली वांट। ईएवी का अगर आप चाहते हैं मुझे अभी जल्दी से बता दीजिए। ईएवी, थैंक यू सो मच, थैंक यू, थैंक यू, थैंक यू, थैंक यू, थैंक्स टू ऑल ऑफ यू। एंड ईएवी का आई थिंक किसी को नहीं चाहिए अभी तक, यस नहीं आया तो ओके, देन आई कैन टेक योर लीव। एंड ओके, शुड आई वेट फॉर 1 मिनट? बड़े लेट आते हैं इसके ऊपर चैट्स। यस मैम, प्लीज टेक फॉर ईएवी ऑल्सो। यस मैम, वी वांट। यस, वेरी ट्रू, व्हाट वेरी ट्रू? ओके, then okay, 2 3 people are there, then what is the advantage of, I mean, okay, let it be then. uh, Not many people are demanding for that, then okay, then I'll take your leave. Thank you very much. Good night.